Hello, everyone. Thank you for tuning in to the Maitri podcast Between Friends Conversations with Maitri. I am your host, Nandini Ray, and today we will be talking about a very important issue which many of us ignore and are uncomfortable to discuss. And that is our mental health, that is our emotional well being. May is Mental Health Awareness Month, and we are dedicating this show to raise awareness in breaking the stigma associated with mental health illness. In this effort, I have invited Rupali Rajvanshi and Niyati Shah, who are working relentlessly to remove the stigma associated with mental health. They are encouraging community members to normalize conversations around their mental health. It's my privilege, it's my pleasure to introduce them. Rupali Rajvanshi has been a web designer, marketing manager, social media expert, and storyteller for different renowned tech companies and startups in the Bay Area. Through RCoz, a nonprofit, she's making a meaningful difference in raising awareness around mental health challenges so that help is accessed sooner than later. Niyati Shah is a career advisor and she has helped hundreds of students in shaping their careers. Niyati works closely with high school and college students, so she has an understanding of how societal expectations and peer pressure can affect students' mental health. Welcome, Rupali and Niyati, on our show.
Thank you, Nandini. Privileged to be together with you.
Thank you so much. It's actually an absolute honor to come forward and talk about such an important issue, which is mental health.
Wonderful. So tell our audience about your organization, RCoz. And by the way, this is a unique name. What is the meaning of this name?
Yeah, that's a good question, right? It's a little hard to understand, but once people get the story behind it, they always remember. So RCoz is a play on our cause because, talking about stigma and the mental health journeys that all of us have gone through, it is everybody's cause. So we played on our cause, we made it RCoz. So that's the whole story behind the name. RCoz is at the beginning stage of a mental health journey. So basically, we are creating awareness through storytelling. And what we find is that, there is a lot of help available, there are on the internet, physicians, there's a lot of help available when you have a mental health crisis. But the issue is, how do you find what the crisis is? So you do not know what the name is, what the vocabulary is. And normally when you hear people like you talking, somebody who looks like you, a story, somebody sharing, that's when you realize, okay, this person has gone through this. I'm also going through this. It's just not in my head. It is really a thing that I need to seek help. So it's all about storytelling and getting to the help right now. We don't have to wait for years and years to find that, the vocabulary to find that help.
Yeah, basically you are breaking the stigma. You're trying to break the stigma because we know that in our community, no one wants to talk about mental health. So you are providing a platform so where people can come and share their story. This is a wonderful initiative. So Rupali, that comes the second question that most people, when we are in our community, when we are not that comfortable talking about mental health, and what was the reason behind it that you started an organization so that people can talk about it?
Yeah, Nandini, that's an excellent question. And so I grew up in India. And, in India, we have all the love and support of our family, but we aren't given tools to actually deal with the emotional well-being. We don't know how to deal with it. So growing up with a family member who had a mental challenge, we were helping him, but we all were going through as a family. Everybody had their own silos. We were all going through our own crisis, but we did not know how to talk about it. And I never talked about it with my friends or, at school. Nobody knew about my issues, right? Like nobody knew what I was going through it because I did not have words for it. I did not know, I almost felt guilty talking about it. If I say, do I come across as this selfish person who's only thinking? That's how we are conditioned, as a South Asian growing up.
Or
But
maybe people will judge me if I talk about this issue that is happening in my family. People will start probably judging me. That's a fear many people have, right?
exactly, right? We live in such a closed, judgmental society, but it's really what I've felt over the years. The judgment is only we are judging our own selves. Nobody else is really judging.
Yeah.
So basically, once I spoke up to somebody, at a conference or something like that, and she's like, "Oh, I totally understand what you're saying because I went through this too." And I mean, like, just that camaraderie that I felt, like, just like, okay, so I'm like, I've been shying away from talking about it for all my life, all my grown-up life. It's not such a big deal issue. It's not a big issue. I can talk about it. And being in the tech industry and the marketing industry, right? I wanted it to be, I've also volunteered at a lot of community organizations. So I'm like, we really need to talk about it. We need to make it more useful. We need to grow it. And that's when I formed the whole formal structure. And we've been doing it for about 3 years. We have about 100 stories. And, and every day is a day of growth for me also. I mean, I'm learning so much.
Yeah. So Niyati, what motivated you to join RCoz?
Well, so being a career advisor, I got a chance working with high school students and university students with the kind of mental stress that they go through, in terms of peer pressure, in terms of, fixing to the expectations of friends, family, shifting countries for their education. So like Rupali said, this is a taboo which usually students as well are not aware about coming forward and talking, as well as there are a lot who doesn't even understand that this is, an issue that needs to, they need to talk about it and it is okay. They just feel it's just them. So when I moved to the US last year, I really wanted to volunteer with an organization which emphasizes on mental health. And I came across RCoz. When I spoke to Rupali, I think I just got instantly connected with the cause because I feel there's a lot which is being talked about, but I think the main problem is to come forward and share the struggles. I think that's something which is a unique thing about RCoz, because it is giving a platform where anyone and everyone can just come forward and share their stories and share their struggles. So when I started out as a volunteer. I initially worked with Rupali on seeing how stories have been recorded, what are we focusing on, and then eventually I just got immersed into the whole cause. And currently I've been focusing on partnership, as well as we are designing different programs where we want more people to get associated with our cause. So we are working on a new program which is focusing on engaging university students, known as a student ambassador program, where we are wanting to create a student community where the students would lead such programs at different universities in the US, and they would emphasize and focus on eradicating the whole stigma and conversations around mental health. So we are really wanting more people to come forward and help in whatever way possible in terms of launching such programs. And exactly that's the focus for our organization in the next few months.
I actually want to also add one more thing. So we are all a volunteer-driven organization. So having people like Niyati, and we have a lot of people who've come with their story and then they decide to stay on because the cause is so, near and dear to them. So, where we are today, right? It's totally volunteer-driven right now. So thank you, Niyati, for all your hard work and wearing multiple hats.
Yeah, and it's a wonderful plan. I mean, so you can expand your program like this, including by inviting people from different organizations, different institutions, so that together we can work to break the stigma. Going through some websites because I know you. I will do this interview with you, and since you have so much experience and knowledge in this field, and I just wanted to ask you right questions. So I was kind of going through a couple of organizations who work in this field. So I saw very disturbing data on the website of the National Alliance on Mental Illness, NAMI.org. That data is that compared to those of other racial ethnic backgrounds, Asian Americans are least likely to receive mental health treatment. Only 20.8% of Asian adults with a mental illness received treatment in 2020.
Yeah.
And so I thought, oh my God, that means 80% didn't receive any treatment, or maybe they didn't report their mental health illness as they didn't want anyone to find out about it.
Absolutely, Nandini, you're so right? It's the whole stigma, and we don't know what's going on.
A lot of systemic barriers in accessing mental health care, including lack of culturally responsive services, probably. But I think stigma can play a big role, a big challenge, big barriers for South Asian, especially South Asian Asians in seeking help. So do you also think the same? And do you think that stigma associated with mental health is way more deep in our community compared to mainstream community? And if it's
absolutely. I think we grow up in this conditioning, right? That we don't talk about our problems in public. We don't talk about it with anybody, right? It can also, like, how we've heard our older people talk about it, like, just pray to God, things will become okay, right? There is no words around it. And when there are no words, then you cannot find help. Also, what we found in our data, that normally when you're going through a health crisis, right, it often manifests at bodily discomforts. Like, people will say, I'm having a headache, I'm having a stomach ache. And so it takes a longer time to reach your mental state, right? Like, people are just missing school days. And what we found is it takes up to 8 to 10 years to find the right diagnosis. And through RCoz, the stories that we are doing, the whole idea is that 8 years has to reduce, right? We do not want people to get help after so long. And combined with what you said, the South Asian, the close community, and the way we are conditioned, it's just not the right process. So we're hoping, please listen to our stories. And, if the audience listen to some stories and resonate with it, share their stories with somebody who needs help. Right? So that's an important part too. It's not just for listening, just for themselves, but somebody, a friend, a family member, right? It's easier for them to point to a story than to tell them that, you go seek help.
Yeah, and it's so many layers. Like sometimes people think that people will judge me. There is a lot of stigma. I shouldn't be talking about this. Sometimes people don't even understand probably that that they are going through some mental health issues, and because because in our community we are not, as you said, Rupali, we are culturally conditioned not to talk about it. Even if we are feeling low or feeling not okay mentally, we don't discuss this with anyone else.
I'm glad that we are doing it, and a lot of people are talking about it, and just May being Mental Health Awareness Month, going to at least reduce the stigma a little bit more in our lifetime.
Maybe, we can focus on spreading more awareness, because as you likely said, there are so many out there who are not even sure of what they are going through. And I think, if our stories reach to them, they'll understand that it is normal to feel in a certain way. They're not somebody who are only alone in this whole journey. So I think, we need to together focus on spreading more awareness.
Yeah. And I was talking to two university students last week, actually, about mental health. And they're also doing wonderful work. Maybe you have heard about them, Manmukti. So those two kids, all the college students, they were telling me that, a lot of barriers to get help. That we are constantly in a cultural conditioning that is restricting us to report, to talk about these issues. And when we are ready to talk about this issue, we don't find any culturally responsive therapist or any system like they who will understand our culture. So that a lot of things are creating roadblocks for us. And mental health, as you described, Rupali, that has often been considered a source of shame, not only to individual, but also to the entire household. Like
Yeah,
people,
to the whole family. The whole
yeah,
family suffers, right?
yeah, people don't seek professional help until this is a crisis because they want to protect their family reputation. When you created RCoz, a community platform for community members to share their stories, did you see that people are reluctant to share, or people just came and talked about it?
Initially, it was really hard for people to share their stories. And Nandini, frankly, it was really hard for me to put it my story also on the website, right? It's not an easy thing to do, but once you've spoken, it makes it really easy, right? So initially, I had a lot of, even for me to ask that question, like, tell me what was your mental health journey? I won't say that word, right? I kept saying, what was the crisis? What happened, right? Like I was not comfortable myself. So it took me a little while to get comfortable. So even for the storytellers, I felt that in the beginning, especially South Asians were very skeptical, who will listen to my story and, where will it go? And then finally, when they're seeing more and more impact of their story, like one story can impact like 10 or, 30 people, right? They are loving the thing that, their life experience is being worthwhile.
I actually went to your website and listened to a couple of stories and was very surprised to listen to that story. That is a story of a doctor. That doctor was sharing her story.
Yeah.
And so can I play that doctor's story with your permission? Are you giving me any permission?
Absolutely. Absolutely. I just want to tell you about this doctor's journey, right? So she's a physician. She studied in India and she moved here as a young married person. She was prescribing mental health to her patients, but she could not find that she needed this help. So I think you should play this clip and it's very, very worthwhile.
Let's play and the clip so that our audience can also know what we are talking about.
I have had a very strong support system.
Family?
Yeah, I have a wonderful husband who is not a physician, who has always been there for me, and I would always get the non-physician, human, sort of abstract perspective from him. That after all, being a physician and your profession is a part of you, but you do have the same challenges as anyone else. So for a long time I fought it on my own, but a few years later I actually sought counseling, and that counseling helped a lot. And I have been able to enjoy my life more, and also professionally, I feel that when I see patients suffering those issues, I have more empathy for them.
You can relate to it.
I can relate to it.
So when I was listening to that story, first thing came to my mind that she's a doctor, so she understands very well that mental health is our health, part of our health. So mental health is as important as physical health. But still, she waited a long time to get help, to talk about her problem. So if a doctor is hesitating, then think about ordinary people.
Absolutely. For mental health, people think it's not their journey, right? It's somebody else's problem, right? And that's why, the story is really important that you just played, because it shows that even though you could be trained in it, but it's for somebody else.
I don't know how to bring this conversation on the forefront so that all of us, we think these things very deeply so that we can normalize this conversation. And thank you, RCoz, for doing that.
Yeah, no, I think even Maitri is doing quite a bit, right? Like I heard Maitri is also working with a lot of these kind of issues too. So I think together we can all make a little dent in this important issue.
So when people share their stories on your platform, what do you expect to happen?
What we expect from one story is a ripple effect. So, you can share the story with a friend, but it doesn't make it so impactful. But when you share it on an RCoz platform, there are thousands and thousands of views. And we've also had like people come back to us saying that, so I'll share another example. So we had a postpartum story that was shared. And what our data shows is 1 in 10 women in the United States go through postpartum, but they do not talk about it because they are new mothers, right? They feel embarrassed, they feel ashamed that they have this perfect baby and they're feeling the blue, right? So they don't even know what to do about it. But postpartum is actually real. 1 in 10 is a big statistic. And so once we shared this story on our platform, I had somebody call me and they're like, how come you're putting it so late? I had a friend who went through this and none of us knew what she was going through. We were just like, what's wrong with you? We kept counseling her, like, you have perfect health, perfect baby, perfect family, no issue about money. Why are you so upset? But when, she heard the story, she's like, now I realize that I wish I could have been more of a support. So through our stories, we help hoping people will get that support, right? They're not alone in their own journey. And that's why we're hoping one story can affect multiple people. It doesn't have to just be my network or her network, right? So these two people were not connected at all, but they heard the story and they thought that it could be helpful. And that's what we're hoping. Through our stories, people find help, self-harm is limited, right? And there's so many stories right now in the media, right? All these people who are going through terrible, suicidal tendencies and stuff like that. And they're saying, wish we had heard about things before, right?
Yeah.
Wish we were not lonely.
So Niyati, do you want to add anything?
Yeah, definitely. I mean, what we are wanting to do through these stories is to create that impact. As Rupali rightly said, there are so many disturbing statistics and data that is available, which is, very disturbing for you to watch. So through these videos, all that we are wanting is use social media as a platform and, make sure that these stories go viral. We want to make an impact in a way that not somebody who's just, experiencing these issues, but also if you can spread across and share it to someone, nearby who's not, courageous enough or who's not that comfortable enough to come forward and share, but at least hearing these stories will help them to understand that it is a normal journey. It's, they do not need to fall down in a deeper mental blockage. It's okay to feel in a certain way. So yeah, that's what we are emphasizing through these stories. We want to create that impact and use social media platform as a tool to, make sure that these stories can go and, get more viral.
Yeah. Actually, we are all immigrants here, and when we come, this is especially like new immigrants. It takes time for them to make that create the community, and we don't have. Most of us, we don't have family members. We don't have like support system, and if something is happening with us, then we don't know how to express that feeling or how to get help or. What is happening with me? Is it normal, not normal? And when you see someone is talking about this issue, like Rupali, you said, postpartum depression, sometimes people, the first time moms, maybe they don't have any idea, any experience. And when they're hearing, and if they're experiencing something like that, they don't know whom to talk to. They don't have family members, they don't have friends. And if they're something is happening like that and they don't know, and when they see someone is talking about this issue, they understand that, okay, I can also talk about this issue, I can also seek help.
And not only them, right? Their family members, right? They can also understand that, why is my wife or my friend or whatever, right? Why is she feeling like that, right? So the stories are, and especially stories that are relatable, right? You don't have to be a celebrity. You don't have to be, someone like an expert on it, right? But still your story is important.
Your story is important, right? Every story is important.
Yeah.
And, it's not easy to bring this taboo topic at the forefront. And it's a very, 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 very difficult job. Kudos to you. But how do you motivate people to share their story on your platform?
So, Nandini, surprisingly, I mean, I think it took me longer than people to come forward with it. So I meet people all the time, right? Like if I meet somebody in the park, in a conference, in BART, and I mean, I'm just generally striking. Actually, I met somebody at the airport the other day. And, you know, just like everybody has a story, and like we just start talking about what are you up to? And they're like, I would like to share my story. So I have met people who ordinarily I would not be comfortable talking. And because they see the effect of it, right? They feel that they did not get help at the right time. You know, they were not aware of the situation. So they are very willing to share. I mean, most of the time, I would say 90% of the people who I approach with a story, they will say that I would love to share it. Like initially they're like, who's listening? And then they come to the platform. They're like, wow, that's something really great. You know, I would like to help with my story. And then they stick around. So it's not only like doing the story and just leaving, right? So it makes our whole impact like really meaningful. Like, you know, I feel like all the effort that we're putting in it is worthwhile.
I'm feeling so, you know, happy to hear that our community members, our community pulse is changing. I mean, it's generally what I saw, you know, 10 years back, people were very, very reluctant to talk about domestic violence, mental health, this kind of taboo topic.
Yeah.
And if they have any issue with them, they don't share that, they're uncomfortable. And even if they don't have any thing going on in their personal life, but they don't want to be associated with organizations who are working in this field. For example, I joined Maitri 11 years back. So 11 years back, I used to see that people are hesitant to, you know, to say openly that I support Maitri, or I go
Domestic violence was such a taboo topic that time.
Speak. But in 10 years, I'm seeing really, really a great change. People are coming forward. They're openly saying on their, you know, they're sharing our story, our social media post on their personal, social media. And they're openly saying, I support Maitri and I want to help them to end domestic violence in our community. So this is a big shift I'm seeing in our community. And so do you, you are also seeing the same. So I am hopeful.
I think COVID also made it really important for people to talk about it, right? That whole isolation for COVID made people realize that one should talk about it. And like, I think rightly you said, right? The shift is focusing, right? I think the generations are becoming more and more open about it. And I think that's why like a lot of people are taking this chance, like you said, Man Mukti, and then we are there, right? Like there are a lot of organizations who are experimenting on what works.
And also, you know, they're coming forward and they're, you know, new to probably it's because of awareness, like people, we are talking about this issue a lot. Many people are talking about many causes, and that is creating an awareness so that, and people are understanding that it is affecting our lives directly and indirectly. So whether it is mental health stigma, whether it is domestic violence, all of us are, affected. Community as a whole is affected by these issues, and we need to do something to prevent it before it is too late. So it is, you know, great to see that our people are supporting. So speaking of which, that I know that many people are supporting you, Rupali, RCoz. So, and you already talked about it. It's a volunteer-run organization, RCoz. So what do they do?
Yeah, so we are a volunteer run. We have a website, we have the recording, we use social media, and now we're starting to raise funds because we want to do programs in a more organized way. So I'm also looking for funding. So we're looking for some grant writers, some grant work. I have a whole team of Accenture volunteers, you know, who are redesigning the whole website, and they've done the usability. And I'm just like, I'm a web designer myself, but the way these people are working, I'm just like so humbled and honored almost. And then, you know, the people like Niyati, right? Like she's got this whole education background and she wants to build this whole program. So everybody comes in with the idea. And also the thing is that, you know, because the team is small, they say it's small but mighty. Ours is like minuscule but mighty. So we are really, really tiny. But
Yeah, I'd really like to add here, definitely volunteering for me specifically has a lot of benefits. I mean, I could support such a great cause, but at the same end, there has been so much of learning because one, there's excellent networking. As Rupali said, we have people, our volunteers, they come from so many different and diverse backgrounds. So networking has been great. At the same end, there's so much to learn, especially for me, it's just been a year that I moved to the US. So understanding the market, the working pattern, how things work here. So there's so much that I would say I have rather learned while volunteering with RCoz, and I've got so much of space to take initiatives. And Rupali has been great as a founder for this organization, where she's always up on whatever you would want to start, like specifically the programs that we are designing, student partners. We're also focusing on starting up a South Asian focus program where we want to create that community. So whenever I go up to her, she's always ready that let's go ahead, let's get it done. So yeah, it has been like a great volunteering with RCoz, and I think it's a win-win. For a volunteer also, there's a lot to learn, and at the same end we are contributing to this great cause of spreading more awareness for mental health.
Yeah. And one more thing. So you asked me what else, right? So blog is another part. I have a lot of students who want to write about it, right? They don't have a platform where they can reach out. So I have students all the time, can we write a blog for you? And I'm like, absolutely, right? Like, so we have and we're doing a lot of technology also. So we're using a lot of Google Analytics. And because I have a technology background and a lot of people want to help in the tech part. So it is a mental health awareness platform, but we're using a lot of analytics and technology behind it too.
Oh, great. A small dedicated group of volunteers can do anything they want to change. If they want to bring a change, they can do it.
Yeah, and I think it's such an important cause for everybody, right? They know somebody, they know themselves, right? So
the Maitri was started with a single phone line at someone's kitchen.
Yeah, I heard about that story. That was amazing.
4 volunteers actually started, and then now we are, after 32 years, we are seen as a trusted agency in the South Asian, in our community, and we have 18 staff members. We have almost 50 volunteers, but it takes time. But somehow we need to start good things, right?
Yeah, so, you're going to follow Maitri's example.
Definitely.
Of course, you are doing a very, very good job.
Niyati was something.
No, I was just saying, definitely we would love to follow their, strategy and the process on how great they are being impacting the community.
So I would also ask our listeners to visit RCoz, your website. It's RCoz.us, RCoz.us. Listeners, please visit RCoz.us website to find many wonderful stories that we were talking about. And I'm sure these stories will motivate many people to see things differently and to take some actions in taking care of their mental health, their emotional well-being. So thank you, Rupali and Niyati, for coming to our show and sharing your work and passion with us, with our listeners. Keep up the job.
Yeah, thank you, Nandini. I hope it'll motivate people to get help sooner than later, and we will see much better mental well-being.
Yes.
Thank you so much for having us.
Thank you. Listeners, when I watched wonderful stories on RCoz's website, I felt perhaps a shift is taking place in our community, in which the stigma that has always surrounded mental health is beginning to fade. Because so many people are sharing their stories on their platform. We are beginning to understand and accept that mental health is as important as our physical health. And this concept helps in breaking down barriers and normalizing conversations around mental health issues. But while this is a big step toward for mental health awareness and advocacy, we still have to go a long way. So in this Mental Health Awareness Month, let's take a pledge that we will educate ourselves about the issue. Together, we will fight stigma associated with mental health, and we will provide non-judgmental support to those who need it.
Very well said.
We are ending this episode with a hope that you will continue, our listeners will continue this discussion with their friends and family. This is your host, Nandini Ray. Thank you all for listening to our podcast. Find all our episodes on YouTube, SoundCloud, and wherever you get your podcast. We have published about 60 episodes so far with domestic violence survivors, advocates, field experts, and community members. On the issue, we talked about the issues that matter to our community. Please share our podcast with your networks and stay tuned.
Thank you.
Thank you.
This show is for informational purposes only and is not to be construed as legal advice. Always consult an attorney for legal advice. Views expressed by guests of the radio show are individual opinions and not endorsed by Maitri.
This project was made possible by funding provided by Santa Clara County Office of Gender-Based Violence Prevention.